Continuing here in chapter 20, talking more about some other encephalitis causes, as well as some prions and some other diseases that affect the brain. Now, when we talk about encephalitis, we talk about subacute. So this is where the symptoms take longer to show up and they're less striking, which allows the immune system a little bit better chance at fighting them off. And these are caused by toxoplasma, persistent measles infections that are not treated properly, and also those prions, those infectious proteins we've talked about. So the first one, Toxoplasma gondii, we'll talk the most about. This is worldwide distribution, and actually the majority of the population will be infected at some point in their life. However, most are asymptomatic and would never know that they were even infected with it. However, infectious of the fetus and those immunodeficient like HIV or AIDS individuals, it is very severe and often fatal in these individuals. This is a flagellated parasite, so again, it has to reproduce inside of a host, and the primary reservoir is cats. So this is why we'll talk about that, good hygiene whenever cleaning litter boxes is very important. Pregnant women, again, because it's transmitted to the fetus, and immunodeficient are the most kind of at risk. So pregnant women should not change the litter box and should limit their exposure, especially to the droppings from cats, just to prevent that exposure, where normally they would be fine, but again, it can be passed on. Again, typically asymptomatic or just kind of some minor symptoms here, and it can be chronic or subacute. So we're kind of focusing here on the subacute, but it can be chronic in patients, especially that are immunosuppressed. Again, we worry most about this one during pregnancy, so about a third or 33% chance of transmitting it from the mom to the fetus. And that congenital infection in the first or second can cause a stillbirth, can cause problems with the liver and the spleen. Hydrocephalus in the brain can lead to seizures, and then ultimately can damage the retina and lead to blindness as well. So again, limiting exposure to the cats. Again, this comes out in the feces, so it's not just from touching a cat, but again, it's more with the fecal contaminant because they form those cysts, and then the cysts, once they're inside of the mom, again, typically asymptomatic, but they can transmit to the fetus and cause the damage that we just mentioned. Now, prions being the other cause of subacute encephalitis, and these are proteinaceous infectious particles. So they have no genetic material. They're not a cell. They're not even like a virus with a protein coat. They are literally an infectious protein. They cause what's called transmissible spongiform encephalopathy. And in humans, the diseases are called Creutzfeldt-Jakob disease, or CJD, Gerstmann disease, Kuru. This is especially seen in tribes where they undergo cannibalism and eat the nervous tissue of other humans that could have been infected, and fatal familial insomnia. Now, just a little bit more about these. Again, the normal protein, so this is a protein normally found in the brain. It's identified as PRPC. What happens is it gets transformed into this infectious protein, which is then identified as PRPSC. Just a little history. SC is because this was mainly identified in sheep and it causes scrapie. So SC was for scrapie because, again, that was what was kind of most studied. So that's where it was named from. So that altered protein then converts other normal proteins into infectious proteins. So that accumulation of these infection PRPSC proteins causes plaques and essentially holes in the brain, and hence the name spongiform encephalopathy. So they can cause disease, though, when transferred to a new host. So again, just like with endospores, we in order to be sterile, that's the highest level. But protein, these prions are not destroyed by autoclaving. So contaminated instruments or ingestion of infected meat. So again, kuru is cannibalism, where they're, in that case, it's transmitted from one person having those infectious proteins and another one consuming them. And this is what the brain ultimately looks like. So our normal brain here at the top, and then one with a prion disease or an infection. So we start to see these holes in the brain from the death of those neurons. So that spongiform encephalopathy. Again, causes here that subacute encephalitis, mainly focusing on the Toxoplasma gondii. Again, that is transmitted mainly through the vectors. So can either be through the meat or the fecal oral coming, especially from the cats. Again, that intracellular growth can occur. So good personal hygiene and food hygiene. Again, most people are asymptomatic. Worry though more with the pregnant moms or the immunocompromised. And then the prions is infectious proteins causing multiple different diseases in humans, mainly Creutzfeldt-Jakob disease. So it's by direct exposure to infected tissue or eating infected tissues. And again, they're an infectious protein, so our immune system doesn't recognize them as being foreign, so they don't attack them, and it allows that disease to occur. Now to rabies, which is probably a disease you've heard a decent amount about, but this is one of the slow progressive zoonotic diseases, just meaning it's transmitted by animals, but it does lead or can lead to a fatal encephalitis. There are a couple different types of rabies. So furious, that can lead to agitation, disorientation, seizures, twitching, and hydrophobia, so like a fear of water. And then also dumb rabies, in which the patient is paralyzed, disoriented, and kind of in a stupor. Both forms, though, are aggressive and can progress to a coma phase that ultimately leads to death from cardiac and respiratory arrest, regardless of which type it is. Again, it's zoonotic, so the reservoirs are in wild mammals that are infected, so like wild dogs, coons, cats, bats, badgers. There are many others. Just kind of name a few. But then they spread to domestic animals or to humans through bites, scratches, or even inhalation of the droplet. So direct contact isn't actually needed. The structure here, the rabies virus, looks a little bit like the top of the lipstick that would be used. But again, we have our protein code here, our glycoprotein spikes. So again, the spikes are what they use to attach to our receptors. It's just that with the rabies virus, those receptors are common among a bunch of animals. That's why it has a huge host range. Remember, host range is the number of different species an organism can infect. So in this case, again, large host range because the glycoprotein spikes recognize a receptor common to a lot of mammals. So then the nucleocapsid, so the protein code in here with that genetic material. So prevention and treatment, so it's imperative that treatment begins after exposure. The nice thing about rabies is that it has a very long incubation. So it's actually possible to immunize after exposure. So typically people are not immunized to prevent it unless they have been exposed to it through a bite or something. And then either passive or active immunization is available. But again, this is because that huge incubation time, while it does lead to a fatal infection, immunization can be administered after exposure. Also, vaccination of domestic animals. Some occupations like vets and those who handle animals, or those who work in a lab with it, or traveling to certain areas. So that helps to prevent as well. And it's also even been incorporated into bait to treat wild animals to prevent its spread. So just a little bit, again, caused by the rabies virus. So again, by either direct contact or by droplets. Again, it is an enveloped virus. It has those glycoproteins for attachment. And again, vaccination can help prevent it as well as treat it. Moving on now to polio or poliomyelitis. Thankfully, and we'll see here in a little bit, this is becoming eradicated, but we still talk about it just because, especially with its different vaccines that are available. So this is an acute enteroviral infection. It's of the spinal cord, so not the brain specifically, but actually in the spinal cord. It causes neuromuscular paralysis. And so that kind of the first symptoms, again, fever, headache, nausea, but then ultimately it infiltrates those motor neurons and leads to paralysis and problems with coordination. Unfortunately, there are still effects seen. So before vaccination, there's a post-polio syndrome. And this is where there was muscle deterioration of those who survived but were infected decades after they actually had the infection. So about 25 to 50% of patients who had polio and survived still had a lot of issues with muscles and being shorter as they aged. So this is a picorona virus. So again, we have our capsid here. This is not an enveloped virus like we'd seen with the rabies. We just have our capsid and then the RNA inside. Now the prevention, again, humans are the only known reservoir, so again, a narrow host range compared to rabies. Vaccination is available as early in life as possible, starting at a couple months of age. Now there are two different vaccinations, which is one of the reasons we talk about this one, is to go back over that concept. So there's the IPV, which was developed in the 1954. That's the one that we use in the US, and it's an inactivated vaccine. So if you remember, that means that it does not have the ability to cause an infection. Again, that's also though why the 4 doses are needed, because it doesn't quite create the immune response that a whole vaccine would. So again, it's destroyed, it can't reproduce, so it's an inactivated vaccine. There's also the oral one, and this is used more in developing countries because it is easier to administer, of course, orally versus an injection that's needed for the inactivated one. It's an attenuated, so that means that, again, it's been weakened, but it still could cause an infection, especially in those who are immunocompromised. So that's the reason that we don't use it in the US, because the IPV is available and just as effective. So just to prevent any possible spread of the disease in those who are immunocompromised, we use the inactivated. But again, because of the benefits of being more easily administered, the oral is used in developing countries. What's also nice about those in the developing countries is that because it's attenuated viruses, as vaccinated viruses, the attenuated viruses are actually shed in the feces, and those can actually passively inoculate others who were not vaccinated. And because of this vaccination and the ease of using and not having to store it, not having storage issues, from 1988 to 2021, you can see that polio's almost been eradicated. So Afghanistan is one of the countries here in the Middle East where there are still some cases of polio, but due to that vaccination success, almost completely eliminated. Now, tetanus caused by Clostridium tetani. So Clostridium we talked about with Gaskine Green back in chapter 19. So it is a spore former, as we had talked about there. So one of its virulence factors. It's also common in our normal flora. So the GI tract of a lot of animals have it. Again, it's just kept at bay so that it doesn't cause problems, but it is very common in soils as well. Now, the endospores are only made in anaerobic conditions. So whenever oxygen is deprived, then they form those endospores. So again, thinking about in the GI system where there's not any oxygen, they would switch to this endospore, and then that would pass through the GI system, through the feces, and then into the soil. Now, this Clostridium tetani, can produces a neurotoxin, and it binds to motor neurons in the brain, in the synaptic nervous system, which is our fight or flight response. And what it does is it inhibits muscle contraction. So it causes them to contract uncontrollably and leads kind of spastic paralysis. So death results from the paralysis of the respiratory system, so not being able to breathe. And this is just kind of showing, again, this tetanospasm that gets released. So essentially, again, it's acting there at those inhibitory neurons, so it blocks the inhibition of contraction. So they're going to remain in a contracted position. Vaccination is also available for tetanus, but in a different form. So this is a toxoid vaccine. So because of that neurotoxin that's made, the vaccination is actually against the toxin, not necessarily the bacteria itself. And it's usually combined with the DTaP, so diphtheria and pertussis toxoids. So again, these are toxoid vaccinations that bind to and recognize the toxin, not the bacteria itself. Vaccination, though, is usually required every 10 years for this one. It doesn't provide lifelong immunity. And usually if somebody has some type of injury where they've been exposed to soil or something like that, usually even at 7 years, if it's been 7 years since their last, they'll go ahead and give a booster shot to prevent any type of infection. And our summary table here, again, tetanus caused by the spore-forming Clostridium tetani. Again, its virulence is the ability to produce the exotoxin. Again, endotoxin is the lipopolysaccharide in gram-negative cells. Exotoxin is something made and released from the cell, so that neurotoxin. Again, prevention using that toxoid immunization. Similarly, botulism caused by another Clostridium species, but Clostridium botulinum, so another spore former. This intoxication here again produces an exotoxin. It's associated in 3 forms. So this is one we worry about with improperly canned food. So a foodborne botulism that doesn't completely remove these spores during the canning process can also be in infants and in wounds as well. Now, this botulinum toxin has an effect on muscles, but kind of the opposite of what we'd seen with tetanus. So in this case, the toxin goes through the blood to neuromuscular junctions, which is where the neuron, so we have this motor neuron here, synapse gap in between where the muscle is. And typically acetylcholine here is a neurotransmitter that would get released. It would bind to that muscle cell and cause contraction. Only what happens here with this toxin is it prevents the release of acetylcholine. So when botulinum toxin is there, acetylcholine can't get released, so this muscle cell can't contract, and it's going to cause paralysis. So tetanus is where it stays contracted because it doesn't get inhibited. In botulinum, it doesn't contract. So because of that, it can actually be used by doctors to treat spasms. So again, it would cause them to relax. It can also be used to treat migraine headaches and some other conditions. Also cosmetically, so Botox injections that help like with wrinkles and that type of thing are injecting this botulinum toxin into those areas. Our summary table here again, that Clostridium botulinum. So again, creates that exotoxin as well as forming spores that allow them to exist for a long time or resist temperatures during the canning process. So again, prevention is from good hygiene. Again, that toxoid immunization is available. This is not typically given though, except for those who work with this organism in the lab. So it's not like tetanus that's commonly given. And it can be treated with different antibiotics. And now we come to our summary tables here at the end of this chapter. So again, identifying those that are spore formers, so like tetanus and botulism caused by spore forming Clostridium species. And then identifying the other diseases. Are they bacteria? Again, I'm not so concerned that you know whether it's gram-positive or gram-negative, but the different causes of meningitis, neonatal meningitis, caused mainly by Streptococcus agalacti, versus and sometimes the Listeria that we see. Again, other meningitis caused by the Haemophilus influenzae. So again, identifying whether these conditions are caused by bacteria, whether they're spore forming, or whether they're caused by viruses, which are mainly our encephalitis caused by the viruses, and different types of arbovirus being the most common. And then again, some others, so like rabies and polio, also the Zika is caused by Zika virus as well. Okay, there are a couple fungi out there, so a couple fungal forms that lead to meningitis. Again, our prions, so Creutzfeldt-Jakob disease. And then we also had the protists, so the amoebas. We mainly talked about the Naegleria fowleri leading to that meningoencephalitis. Again, thankfully these are rare, but they are very, can be fatal. Also talked about the toxoplasma, especially with pregnant women, to avoid those cat litter boxes because it can lead to that subacute encephalitis. And again, our summary table, again, just kind of looking at the different diseases so you can see whether, so here like subacute encephalitis is caused by, can be caused by a protist, can be caused by a virus, can be caused by prions. So multiple different categories of microbes there, whereas rabies, again, only caused by a virus. Again, encephalitis by the viruses. Meningitis, though, again, we can have fungal causes, bacteria, or viruses.